In my early career, I worked in a rural area, and while the service delivery for substance use disorder there was excellent, very well coordinated, all the practitioners were talking to each other, the clients were slipping through the cracks on their chronic disease states. So diabetes was out of control. Hypertension and heart disease was out of control. And what I mean by that is those conditions were progressing, not being treated effectively, because they would go to their GP and their GP says, oh, you've got a doctor over there who sees you, referring to harm reduction treatment. And they would go to their harm reduction clinic and they'd say, well, I need to speak to somebody about my insulin dose. And no, you see your GP for that. And so the disconnect wasn't in amongst the practitioners in the harm reduction space, it was around all the other rest of the health system. And we still see that now. You know, we see people who are not able to access all the areas of healthcare that they need. And so the stigma around being in harm reduction affects their access to other care as well.